Destiny. I'm originally from Central Illinois, but I live in Orlando, Florida now. I'm a nurse, so I'm kind of on my little vacation. So I'm having Lipo 360. I'm having my second round of Lipo 360. My first round was in July of last year. There were certain problem areas. My abdomen, I wanted to get rid of the fat in my abdomen and some of my back fat. So it was something that exercising wasn't happening quick enough for me with exercising. So I went ahead and took the quick way. I'm super excited for my second procedure. This time I'm getting my arms done along with my Lipo 360. So I'm kind of nervous about if I'm going to be able to lift or anything after surgery. I'm nervous about that part. But I think the first time being nervous, it was because I didn't know. It was not knowing what was going to happen. Now, I'm not really nervous because I know I've been through it before. So there's not anything that I don't know about it, and I've done plenty of research. So I'm prepared this time. I'm more prepared than I was the first time. Super excited. My doctor was Dr. Timothy Alexander. He's amazing. His bedside manner was amazing. He was a great doctor overall, and the results were amazing.
We're going to do liposuction of the abdomen, flanks, back of the arms, and upper and lower back. It's going to take a little bit over an hour to do.
Okay.
Because we've got to flip you over. That takes a bit of time.
Mm-hmm.
If it was just the front, it would probably take about half an hour, but we're going to do your arms and your back and everything too.
Okay.
Okay?
Yeah. So how are my arms? Am I going to be able to lift at all?
Yeah.
Yeah. Is it? I am. Yeah. Okay. It's not going to be that.
As I said, I'm going to get bruised up, and I'm going to put, as I said, I'm going to wrap your arms up today, and we'll take them off and post-op tomorrow, and you can leave them off. But you have to wear the binder around your waist for a month.
Okay. I heard about South Florida Center for Cosmetic Surgery through a friend. She had actually had a tummy tuck with Dr. Timothy Alexander also. So I looked into his work. He seemed like he was a pretty good fit for what I was looking for. I chose him. When I decided to choose South Florida Center, I had been watching their Instagram for some time, and I kept seeing pictures of everybody being snatched on their Instagram, and I was like, I gotta be one of those girls. Like, I gotta go get my summer body together. While COVID is still hot, let me get in.
Good afternoon, I'm Dr. Pitluck. I'll be doing your anesthesia today. So here's what's gonna happen. The nurse is gonna come and get you. She'll help switch your gown around open to the back. And when you come to the room, the first thing we're gonna do is position you. The position's on your back with your hands out at your side like this. The table isn't flat. There's a special cushion that we fit you into. It allows us to maximize the amount of fat we can retrieve. Once we're happy with your position, I'm going to put an oxygen cannula under your nose because you need to fill your lungs with oxygen before you go to sleep. At that time, I'm going to add some relaxation medicine to the IV to take the edge off things. Then I'm going to get you ready for the surgery, put all the monitors on, check your vital signs one more time, make any adjustments we need to do this safely, then you'll be ready for the sleep medicine. When we give you the sleep medicine, you're going to feel a hot sensation go in the IV and up your arm. By the time it gets to the top of your shoulder, the next thing you know, you're talking to the nurses.
Yeah, last time I don't remember any of the stuff you did.
But that's exactly what's going to happen. Even though the surgery will take about an hour and a half or so, it's going to feel like 5 minutes from the time I tell you that you're going to go to sleep to the time you're in the recovery room. Now the recovery room time is about an hour to an hour and a half. When you're fully recovered and you're feeling well, they'll let your family pick you up. Okay. You have any questions? Okay.
I'm ready.
Don't worry. Everything's gonna go perfectly. We're gonna take good care of it.
All right, I trust you. On my surgery day, when I came in, of course, everybody was masked due to COVID. I had to be tested for COVID before I was able to even come to the facility. And I had to show a negative COVID test. They also tested me at the facility before surgery. Dr. Alexander came in and kind of drew on me and asked me what I was looking for with the procedure. And after that, they ran my IV drip, and maybe like 30 minutes later, I was going to surgery, and the anesthesiologist is amazing. I didn't even know I was going to sleep. We were having a conversation, and I told him I was tired, and he was like, all right, I'm going to get you some sleep. And that's the last thing I remember.
This patient is wanting liposuction of the abdomen, flanks, upper and lower back, and the back of the arms. Because the patient's had previous liposuction, there's a lot of scar tissue underneath the skin. And it's a lot easier to penetrate the fat with this small cannula.
I actually don't remember waking up. I don't remember waking up. I don't remember going home. I did have some family members say that they were called because I told the post-op girls that my mom was picking me up, and she lives in Illinois, so obviously she couldn't pick me up. But they did make sure that I got to the car and got home safely. I did get home safely, but I don't remember any of the post-op and up until like 4 hours later after waking up. I'm Destiny. I had lipo 360 and lipo of my arms yesterday. I feel great. I'm up, walking, moving around. Feel great. So my recovery was a little rough. The first day it tricked me. The first day I didn't have any pain. I think it was because I still had the anesthesia in my system. I didn't have any pain, so I'm like, oh, this is easy. Then comes day 2. Then the pain started to come. It wasn't too bad, but it was more than I expected. And I didn't take any pain pills the whole time. I took Tylenol. I didn't take the hydrocodone they give you because I just didn't want to do the narcotics and slow down my digestive system. So day 3 is when it hit me. I had a 10. From 0 to 10, my pain was 10. I couldn't shower by myself. I couldn't change positions in bed by myself. I needed help with everything. After day 3, the pain lasted for another maybe 4 days, but the pain lessened after day 7. The pain started to go away, but there's still pain. Hi, I'm here at the South Florida Center for Cosmetic Surgery for my 1-week post-op appointment. Today I'll be getting my stitches removed. I'm feeling great. I don't have any pain at all. Able to get in and out of my garments with ease. Just a little swelling, which is normal, but my stomach is flat even without the swelling. So Dr. Timothy Alexander is the guy. How are you?
Okay, so you're gonna get your stitches taken out today.
Yes. I got all the tape off for you.
That's all right. Listen, this is about the most swollen you're going to get now, 1 week afterwards. So in the next 3 weeks, you'll see a lot of swelling going down, and then up to 3 months, you'll still even shrink more.
Okay.
Okay? So we're going to take your stitches out today, and I'd like to see you again in 3 weeks.
I recommend South Florida Center for Cosmetic Surgery for anybody looking for any cosmetic surgery. It's not from the surgery coordinator. When you first do your consultation, she checks in on you. It's not about, the payment. Even after your payment is done, they check on you, they email you for holidays. Even after my surgery, they called me, they checked on me. It just made me feel like I was part of the family here. They were really amazing, and the bedside manner was really amazing.